You're recording. Hey, everybody, welcome to the TIMGA Podcast. Today I'm here joined with Dr. Winmar Larkin. She's an MDCE physician and here in Washington State. She's also a member of TIMGA. And today I just wanted to, get her information on what she thinks about the MDCE license and also, her journey and all that. So, Dr. Winmar Larkin, welcome to the show. I'm super excited to have you. How are you doing today?
Yeah, I'm doing great. Thank you for having me. I'm also really excited. Sharing my experience, and this is really good for our fellow IMG who, really excited about the MDC opportunity, things like that. So, thank you.
Yeah, of course, of course. Hey, I'm always excited to talk to fellow IMGs and especially doctors who are working with the MDCE license because for me the MDCE license is very personal. I started advocating for the license, back in 2016, and this is my dream. My dream was to see doctors like you, working and taking care of patients with this license. So, before we get to that, when can you talk about a little bit about your journey? Coming to the U.S. as a doctor, not being able to practice, having to do the USMLEs again and the ECFMG process. Tell me about your journey. Like, what was it like?
Sure. Thank you. And again, I really appreciate your great support and effort, to make your dream come true. And now all of our IMG are really excited and happy, seeing your achievement and already, and I myself being involved in what you did for us. So thank you, and I really appreciate for that. So yeah, for me, I'm originally from Myanmar, one of the Southeast Asian country. It is a small country around. Our neighborhood countries are Thailand, China, India, and so yeah, I graduated from my medical school back in 2008, and since that time, I have been working in the healthcare setting as a physician in hospital, and also I run my own clinics. And um, my my last position was assistant director in Ministry of Health. And when military took over the power in 2021 February, I was narrowly escaped, and because civil disobedience movement, and due to this kind of political situation, I finally have to resettle in the United States in 2022 January. Um, it's uh, it's a really challenging journey for I would say for everyone who have to resettle everything in a new environment. And for me, I have been working as a physician, in a healthcare setting for many, many years. And here I have to start like my career from the almost beginning. So my first job here is was a pharmacy technician in a pharmacy, and and then I try to explore, is there any opportunities which really align with my background experience and my education, credentials. So I graduated from medical school. I got my Master of Public Health degree in back in 2014, and I have many years of experience working in healthcare setting, both in clinical and public health fields. And fortunately, and then I got another job as a health services manager in the refugee organization where they held me as a client. So I became a refugee and they held me. And then now I applying for the health services manager position, and I got the job. And it's kind of very it was a very privileged opportunity for me because it expand my professional network, and I learned a lot of things about United States healthcare system, how to implement community health programs, things like that. And so my ultimate goal is I really, really want to reactivate my medical license here in the United States. So the big challenge for me is due to the political situation, it's really, really hard even to get the USMLE exam permit.
Oh wow.
Yeah, it took like years because the prior medical university back in my home country, they won't issue any credential verification things because they are, functioning under the military, Myanmar military instruction. So I don't know how to say, changing their working environment and uh, it's not, it is very uncertain if I will be able to take the exam. So finally, the ECFMG, they created the alternative pathway
Mm-hmm.
who couldn't get the credential like us. So finally, we got the exam permit. So it took like a year, dealing with this kind of issue. And then I passed my USMLE step one in 2024 December. And then I took my step two and I passed it in August 2025. And
Nice.
then yeah, so it's kind of dreams come true for me as well.
Mm-hmm.
And during meantime, I'm trying to expand my network through LinkedIn, other social media, and I learned about your organization, TIMGA, which is very helpful and very popular among IMG, helping them like mentally supporting us and also trying to connecting us with available opportunity to renew our medical professional career. And also we also receive some stipend, which is really important. The USMLE journey is very, is cost. It's a lot of money. So in this way, I have connected with your organization, and you have and we also have the separate group for study group, and also sharing like OET English language training and session things like that. So yeah, I really appreciate that kind of uh, help for us, and it means a lot for not only for me, for almost all IMG. So yeah, I would say there are many challenges has been pursuing the USMLE journey. The first one is for me is like credential, getting credential in a timely manner. The
Mm-hmm.
second one is like the the cost, the fees, the financial challenge, and
Mm-hmm.
the third one would be, I would say, there are limited opportunity for IMG to get the US clinical experiences,
Yeah.
because it's really important. Someone who trying to get into residency program, or trying to get like MDCE program. So I would like to emphasize that if we can create, if you can create or help us with potential US clinical experience opportunity, that would be great in preparing for the readiness in MDCE position as well.
Yeah, yeah, that's amazing. And when and also like for you, like it's a specific case, and usually it's everybody from Myanmar, right? They have to get their credential verification process. So how does that work? What is the alternative pathway if ECFMG? Is it you? Do you have to find doctors from Myanmar already practicing here?
Yes, yes. So I, yeah, recently I recognized that some of the other countries which they also experience in the
Same thing,
political
yeah.
instability. Yeah, so
Yeah,
they
like
have like,
Eritrea. I know Eritrea. A lot of people from Eritrea, East Africa, they're having the same issues as well.
yeah, and they have some pathway with WES, World Education Service.
Yeah.
So World Education Service is helping them their credential verification process. So, but not for our country. So yeah, as you mentioned, so our Myanmar IMG need to uh, reach out to the fully licensed Myanmar physician who has been practicing in the United States, and we need some attestation, your things. So ECFNG directly reach out to them and asking if we, our credential, and our degree conference, things like that. And then we also have to send our diploma to uh, the like translation service. ECFNG
Mm,
recommended. So yeah, it's the current alternative pathway for Myanmar IMG. I would say if the WES, World Education Service, can also help us, that would be great. I mean, so I know there are a lot of Myanmar IMG who are waiting for the exam permit and getting, you know, uh, it's not that easy. I
how long
mean,
does it take? How long does it take to get the permit?
oh, for me, uh 7 months at least.
Wow.
Some people, yeah, they have to wait like a year, a year and a
Wow.
half. It depends. So yeah, so for me, I mean, at that
Yeah.
time, I was okay. Should I stop studying now, or should I study? Uh, so a
Yeah.
lot of emotional things and a lot of uncertainty at the time. Yeah,
Yeah.
and then I passed my step three last month in February 2026. Now
Mm.
I clear all the USMLE steps, and then in February last year, I I came across with the your organization announcement about MDCE, and I applied immediately after I saw your announcement.
Yeah. Yeah. Tell me about that process. How you like working with Dr. Sam Shea and We Are Docs, and
Yeah,
so tell
yeah.
me like when you found that job and you got into Altia, um, what was the interview process like, and
That's great. I could never, I mean, forget this experience, because it's kind of it's it's like you said, it's kind of dream
yeah,
comes true. Uh, so I love my passion. I believe every IMG love our passion career, seeing vision, working in the healthcare setting, and working with the team. So when so the firstly I saw your post, about the available MDC position in Washington State. I was really happy because they removed one of the criteria about the resident.
yeah,
So, yeah, previously I when I learned MDC position, but you have to stay in Washington State for like 1 year.
1 year, yes,
So yeah, at this time, oh, this not possible for me now, and then they remove this eligibility, and I am so glad, and I immediately reached out to Dr. Sam, and yeah, I sent all the document, my USMLE school, ECF, and certificate, and everything, and yeah, and when Dr. Sam called me and we chat on phone, so uh, it's kind of the virtual interview, but
yeah,
it's really encouraging the way Dr. Sam, when he shared about how much the great work you guys are doing to, create more opportunity for the IMG, and the way you guys are advocating the legislation process. It's really amazing, and then I I believe Dr. Sam also acknowledged my passion and my excitement, my eagerness to join the MDC program, and I think I got the official another job interview. I think within 1 week.
oh wow,
Yeah, within 1 week, and some of the I think
what was the other interview you got?
no, no, after
Oh yeah, 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 okay, 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 the second interview, yes, yes,
second interview with LTR.
yeah, yeah, yeah,
Yeah, yeah.
yeah, yeah,
So the LTR HR manager reached out to me on phone, and we talk, and oh, I'm ready to
and,
get started. Yeah, yeah. And then I think
yeah,
they set up the interview next week. It's like very very quick. It's it's happened then. So,
Yeah.
and then yeah, during my interview, I met with one chief medical officer and another HR operating director. So two people interview
Yeah.
me and they are asking about my background experience, what I am currently doing. At the time, I was in San Jose, following an attending physician in a skilled nursing facility.
Mm.
So it's kind of good timing because MDCE position also mainly for the skilled nursing facility, and I
Yeah.
was, yeah, I was, I'm kind of familiar with the EMR software and how to daily how to make daily patient care around something like that. So, and then I got a job offer the next week.
Oh
So
wow.
kind of
Yeah.
pretty great things, and I can believe, oh my gosh. So uh, I I almost cry, honestly,
Mm.
because I've been working as a pharmacy technician. I'm working in the community health programs, and I'm been following the attending physician as an observer, and
Yeah.
then I've been hoping, dreaming when I will be able to see the doctor as a doctor.
Yeah.
So this is a very, very great opportunity. Not only me, it's a effect on my parents.
Yeah.
So yeah, so
That's
yeah,
amazing.
yeah.
That's amazing. And I think right now you're working for LT almost 1 month in a few days, right?
Yes, yeah, this is my fourth week. So
Yes.
yeah, it's almost a month. I've been working in the skilled nursing facility, post acute care,
Yeah.
whatever.
How's it? Tell us about experience. Like, how are you liking the
Sure,
job?
sure. Um, yeah. So the scope of our work is, so mainly we are focusing on the rehabilitation, long-term care patient. Mostly they are senior people. So if someone like so as a physician, it's kind of geriatric care
Yeah.
plus, like, yeah, that the we are here, every physician, every Medicare provider, we also prioritize the patient consent and patient consent for the goal of care. So
Mm.
generally speaking, we are following, how can I say, we are managing the chronic complex cases,
Yeah.
but the focusing on their consent,
Yeah.
their preferred goals of care. And here, so our team usually, SNF management team includes the physician, NP or PA as a provider, and then we have the charge nurses, and we have director of nursing every day, and we have social. We have to work with social service director every day, because this is the SNF case management is pretty much related to the social determinants of health.
Yeah.
So we cannot provide only medical treatment for our patients. So this is a integrated team working
Mm.
together every day. And so usually in my facility, current facility, we have like the total number of residents between 55 to 65
Yeah.
range. And mostly my daily patient encounter is between like 15 to 20 a
Yeah.
day. It's based on workload, and if we have some emergency or there is something, we have the limited resources, we have to refer our patient to nearby urgent care or ER or hospital
Yeah.
for the further management. Yeah.
Yeah, yeah, that's amazing. So, like, you're mostly doing geriatric care, and you're seeing patients. How is it like? Maybe for like some IMGs like who wanna do the MDCE, where maybe like because it's a different system, from
Yeah.
different countries.
Yeah.
You gotta do EMR. You gotta work with a multidisciplinary team, as you said,
Yeah.
social workers, nurses, managers,
Yes.
patients' families. So it is like a multidisciplinary system that a lot of IMGs are not, familiar with.
Yeah.
So, what,
Exactly.
what would you like advise to somebody who's about to become an MDCE doctor? is there something they can do to help them feel more prepared?
Yeah, that's a great question. Yeah, I would say like three things. Firstly, so to I would say to trying to improve the communication skill, because as you mentioned, there are a lot of we have to talk with we have to communicate with a lot of various position like the nurses, social services group and manager, and also patient themselves, and also patient their family members. So the communication is a key. So the simple, straightforward, clear communication would be would lead the relationship is clear and effective. So I just want to share this is really important. The second one is um, uh, to improve our background knowledge and applying this to the real situation. As you mentioned, we have a different system between our background experience and current United States health system. So, uh, but there will be there is a the training orientation period before we start our independent patient round. So LTR gave 2 days online training how to use EMR properly, and they have really amazing AI tools, which is really helpful for us to finish our patient notes and to looking for the patient information in a very quick way. So
Yeah,
and then we have like orientation. So that would be great. If this is a very great support for us. The third one is to improve our medical knowledge. I mean, everybody already passed USMLE step 1, 2, 3, and but so for in reality, our specific common specific patient group is geriatric. So we if we are like efficient in managing like chronic case management, which is very common in this age group, that would be great. And the other thing is uh, to improve the knowledge about the uh, different uh, the insurance plan, and we have some rules to follow within the scope of SNF management. So I think uh, those are a little bit of different information what we did in our back home country. So yeah.
yeah. That's amazing. That's amazing. And I think, yeah, that's really important, just to know the domain that you're
Yeah.
going to go into, get some more information about that. And so, yeah, great, great advice, Dr. Wynn. But okay, now I want to talk about recently you announced on LinkedIn that you matched into a family medicine residency. Congratulations.
Thank you.
And I think you're going to California. Is it California
Yeah.
residency, right? So
Yeah.
congratulations on that. So tell me about, how did you feel like once you got that letter? Tell me about a little bit about that process. Tell me about the interviews, like
Sure.
um, how many interviews did you get? Because a lot, I speak with a lot of IMGs. They are very unmotivated because
Yeah.
it's difficult for old graduates. I know you
Yeah.
said you graduated in 2008.
Yes.
So tell me, like, how is the residency process for you?
Yeah, that's a great question, and yeah, including myself, or almost all of the IMG with all graduate are kind of feeling and uncertainty throughout this residency application process. So for me, once I have so my preparation start when I once I apply once I got the exam permit. So before I got the exam permit, it was kind of uncertain condition. So because I understand the how difficult residency process as an OIMG. So once I prepare for USMLE step, I try to expand my network. So my main social media network is LinkedIn. So
Mhm.
I built up my profile. I put every credential. I share my experience, and I share my background. And I mean, I'm just sharing my story and how it is kind of proving how much I am, working very hard to get back my medical license, my profession in this new environment. So it is not for asking any favorness or something like that. I'm just showing myself, and I'm trying to I build up my profile in LinkedIn, and then I joined so many study group, and I joined so many Zoom session, online training session who support us to prepare for US residency. And then so after that, when I chose to apply for the residency program, so I gather some the information which program are IMG friendly, and also some of them they have very flexible eligibility for year of graduation. So I didn't apply for the resident program who has very strict YOG. So firstly, IMG friendly. Second one, I look for the no limitation YOG, and the third one is I focus on applying to the residency program with rural area community health focus.
Okay, nice, nice. And how many programs did you apply?
So yeah, I applied to 151 program. You can.
Wow. Oh my
Yeah, it's
goodness.
hard. I mean, it is hard for us, but for me is I want to try as much as I can. You
Yeah.
know what I mean? So yeah, it's financial thing is really challenging, but I would say because I really wanted to do this way, and I would not spend this money in other things. So,
Yeah.
and also I was lucky enough using LinkedIn social media because when I because of my post about my USMLE preparation and my achievement, one of the organization from Poland reached out to me, and they provided me some financial assistance as well.
Oh wow.
So
That's
yeah,
really cool.
I really want to encourage all the IMG. Please use LinkedIn mainly effectively.
Yeah.
So they even reach out to me. They send a message. Hey, when we saw you are preparing USMLE and you are the refugee resettle in the here, so we really want to support you. So they gave me USMLE some resources fees, uh, buying purchasing you and also some exam fees, and also for the during my residency application they provided me some financial assistance to for my application. So and I got 7 interview invites.
Wow. That's amazing.
Yeah, thank you. And
Is it
yeah,
all in family medicine or internal medicine?
no, as an IMG and as a OYOG, apply both IM and FM. So uh, every opportunity are, very really great for me. So I got 4 internal medicine interview, and I got 2 family medicine interview, and the other one is transition a year program.
Oh nice. That's
Yeah,
amazing. Amazing.
yeah,
That's
and
amazing.
I
Yeah, and basically, so and after that, when you did the interviews, how did you feel? Did you feel confident? How did you feel?
honestly it's kind of mixed feeling.
Yeah.
So usually my interview it takes like at least 45 minutes to like 4 hours sometimes.
Oh
So it
wow.
depends on the program. So
Yeah.
some
Did you
program
fly or was it remote?
it's all remote fortunately.
Oh
Yeah,
wow.
yeah, it's all
Oh,
remote.
because
Yeah.
I remember like I used to do residency interviews before COVID. There was no remote. Yeah. So,
Yeah,
yeah, we used to spend like days,
I
going
see.
places. So
Oh, yeah, that's what you said. Oh,
yeah.
but we have like second look session
Yeah.
after the interview. So second look is in person. So I have
Yeah.
to fly like like 3 different states
Oh
after
wow.
the interview.
Oh
Yeah,
wow. Okay. Wow. Wow. Wow.
yeah.
Well, congratulations. I'm really happy that you're going to California. Is in June or July? Are you going?
It will be in June
June.
because the program wants to start early for the orientation.
Okay, that's amazing. Congratulations. We will all be cheering for you. We will make sure that we invite you for future podcasts
Okay.
or and all that, so you can help others IMGs as well.
Sure.
Um, Again, thanks for joining us today, Dr. Winmar Larkin. Any final thoughts or advice for our IMG listeners?
Oh, well, so just keep on doing what you are doing. So there are a lot of opportunity, and we have the great support from TIMGA, and we are doubts, and I believe those, the all of the IMG will be getting their profession back very soon. Thank you so much for your great support.
Of course, Dr. Winmar Larkin, everybody, MDCE physician and now family medicine resident. So thanks
Thank
for joining us
you.
again.